In most parts of the country, fewer than half of Canadian children ages 5 to 11 have received their first COVID vaccine dose, but there are 3 places leading the charge with high vaccination rates. Newfoundland and Labrador has given first doses to more than 74% of all children aged 5 to 11. Nova Scotia second with 64% of kids having received a first dose, while Quebec not far behind with just 61%. And tonight we want to talk to doctors in those 3 provinces. Dr. Earl Rubin is the Director of Infectious Diseases at the Montreal Children's Hospital. Dr. Katrina Hurley is Head of Pediatric Emergency Medicine at the IWK Health Centre in Halifax. And Dr. Natalie Bridge is a Pediatric Infectious Diseases Physician with Eastern Health in St. John's, Newfoundland. And thanks to all 3 of you for joining us.
Thank you.
Dr. Hurley, let me start with you, and you were just on shift today at the IWK, and I'm wondering what you're seeing at your hospital in terms of children with COVID.
So we certainly have a number of children who come and visit the emergency department after testing positive for COVID at home. We aren't seeing many children who require admission to hospital at this point from their COVID illness. So some of these children come in with a headache or fever. We've seen children present with simply vomiting. And this time around, we've seen more children with croup than we've seen in previous waves.
And Dr. Rubin, what about at your hospital in Montreal?
Yeah, so in terms of what's seen in the emerge, it's like Dr. Hurley said, in those who are coming in at any one point in time since Omicron has hit, so since mid-December, we've had anywhere between 5 and 10 kids admitted who are COVID positive. They're not the same 5 or 10, there's a high turnover. What's really interesting though is about half of those kids are not admitted because they have COVID. They're found to be COVID positive. They're admitted for elective surgery, a trauma, or something like that. And then we test everybody before admission and we find that they're COVID positive. So it's only half that are being admitted because of COVID.
And Dr. Bridger, you're not seeing really clear patterns in St. John's, I guess, because you just don't have a lot of pediatric COVID admissions.
Yes, so to date, for the whole COVID pandemic, we've only seen 6 pediatric admissions in our province, and 5 of those have been since the appearance of Omicron at the end of December 2021. So I can't really get into any sort of patterns of symptoms that we've seen in admitted patients because we've had so few. Our Omicron wave sort of coincided with the closure of schools for the holiday season. So in that sense, I think that probably prevented some pediatric admissions down the road.
Dr. Rubin, in terms of the children who are coming into hospital with COVID and particularly the ones with severe symptoms, is there any clear difference between vaccinated and unvaccinated?
It is clear those that are admitted for COVID who are a little bit sicker tend not to be vaccinated. However, about half of the admission are not even vaccine eligible. Because they're under the age of 5. So when you look for 5 and above, those who are more significantly ill because of COVID and not being admitted for other reasons, they tend to be non-vaccinated.
So, Dr. Bridger, let's talk about Newfoundland and Labrador and those really high numbers, so much higher than the national average of kids between 5 and 11 who have had at least 1 shot. Why is that, do you think?
I think there are a few reasons for that, Ian. I think number one, Newfoundland and Labrador has a culture of vaccine acceptance because we've had decades of a really strong public health nursing system that's primarily given childhood vaccines. And so there's been a lot of confidence in childhood vaccines. So I think that's the first part of the equation, that vaccines have traditionally been more acceptable. Second, I think that our population has a lot of trust in our leadership. Our Chief Medical Officer of Health, Dr. Fitzgerald, has managed the pandemic for the past 2 years very steadily, and people trust Dr. Fitzgerald and her team. And thirdly, the leadership made it easy for people to get their kids vaccinated. So they gave people options of either taking their kids to mass vaccination clinics, or they gave parents and caregivers the option of getting their kids vaccinated in the school system. So I think that the combination of acceptability and accessibility really helped get the momentum going in Newfoundland and Labrador.
Dr. Rubin, I know your expertise is not in public health, but I'll ask you, do you think there should be a campaign to increase the number of kids who do get vaccinated?
Absolutely. Where the campaign really needs to spearhead is from the primary caregiver for that family. A lot of parents will turn to their pediatrician and say, what do you recommend? The question that I'll often get is, what did you do for your kids? And if they hear that their physician is vaccinating their own children, they are much more open to the discussion. So yes, public health put it out there, but what's more important is the people who know the patient and the family, and to sit down and listen to what their concerns truly are and address them, and don't judge them if they're nervous or they don't want, but to listen and to be able to address the concerns that they may have.
And Dr. Hurley, at the emergency room at the IWK in Halifax, I don't know, does vaccination for COVID for kids come up much? And if it does, how do you handle it?
I would say it's interesting the way it comes up, because I routinely would ask people if their vaccinations are up to date. And I'm usually meaning all those other vaccinations. But now when I ask that question, there's a presumption that I'm speaking only about COVID. I think it's the vaccination that is top of mind for most people that are coming in. And I haven't seen that sort of reaction with influenza vaccinations, for example, or with any other vaccine. And I agree with what Dr. Rubin had just said, is that people ask, what are you doing? And how would you respond? And so I try to answer both as a physician and as a parent, and that I vaccinate my kids.
And Dr. Bridger, let me finish with you. I guess a really important point here is to make these vaccinations as accessible as possible.
Yes, absolutely. I think that leadership and public health leaders need to take a look at their populations and figure out how can we make this vaccine as easy as possible for families to access. And so, in our case, it was giving families options in schools and mass vaccine clinics. It could be different in other places. So yes, I think accessibility is one of the major driving factors here.
Well, it certainly has worked in Newfoundland and Labrador, and in fact, all three of your provinces, pretty high rates. Thank you very much for speaking with us tonight.
Thank you.
Thank you.
Pleasure.